Thank you, Chairman. And Chairman Franks, thank you for those highlight on the efficacy of the measles vaccine. There were a couple things that I thought were missing in the presentation, and no criticism, but I want to make sure as we're having this discussion about public awareness that people are really clear about what we're talking about in MMR, measles, mumps, and rubella. So measles, because you've got all the symptoms and everything that can happen here, you also highlighted the fact that vaccine is the best way to prevent. But I want to talk about when people get sick. Mm-hmm. There's no treatment at that point, correct?
There's
you can get vitamin A and be put in the hospital.
Yes.
But there's no give me the pill now once your child is sick.
Yeah, I'm sorry to interrupt. Yes, there's no antiviral that's specific for measles. There's supportive care, including some data behind vitamin A, but that's after you get sick. It's not preventing it. It's after you're already ill.
And so that's why we're seeing children who can die, that this idea that, well, I'll just let my kid get it, they'll build up immunity, it will be fine. You said 20% of these kids are ending up in the hospital.
Correct.
And in fact, when we look back statistically with where we were in measles, back in the United States when we started tracking it back in the 1950s and then into the 60s, we were looking at, like we saw in COVID, multiple spikes up and down, and we were getting 700,000 cases, correct, at a time.
Every person was getting infected by adulthood, basically, almost every individual living in the United States.
And then vaccines were licensed in 1963, and over the next decade, we saw that drop significantly, almost to nothing. And as you said, in 1971, we all got one shot. Mm-hmm. And that's, I've heard 90%, I heard you today say 93% effective, correct? And so for folks like me, who were a child in the 70s and early 80s and got my vaccine, I've actually only had one. Mm-hmm. And so there is an argument that some folks may need to get a boost and get that second dose, correct?
That's correct, especially in these areas where there is an active outbreak going on.
Because that 6% of efficacy can make a big difference in healthcare, especially when we talk about herd immunity, correct? For those that are after 1989, they got 2 doses.
Exactly.
Mm-hmm. And the nice thing about measles is once you get that treatment, you're really done, except for those very few 3% cases that may contract it and get it. And so the nice thing, again, about a measles is in 2000, we started to eliminate this disease, and it hasn't really changed. It's one of those that's pretty stable and secure, and we know what happens, right?
Yes.
So in 2004, in 3 and 4, in Texas, we saw 2,314 religious exemptions as reasons not to get the vaccine. To date, that number has continually climbed to now that we have 118,572 people claiming religious exemptions for purposes of not getting a vaccine. Do you think that those are purely religious, or do you think that misinformation and disinformation and illogical causes around the lack of understanding of science can cause to the contributing factor for people claiming to need an exemption?
So it can be for a reason of conscience, but I don't know any specifics beyond that, just that we get that exemption or information about that exemption from the school districts.
And as you said, if it gets to 5%, we lose herd immunity in the entire county, right? And these dark blue sections are showing almost 35 counties at least that are getting close to that tipping point in the state of Texas. Is that your awareness?
Yes.
All right. I want to talk about some of the disinformation and misinformation, and not that people, I get it. People are worried and they're concerned. We've heard people say MMR can cause autism. And I think you said it's safe, we recognize it's safe. So there is a distinction for folks that have an anecdotal story of, hey, I got my baby vaccinated between 7 months and a year, and then my baby started showing symptoms or signs of things like autism or other genetic diseases that don't present themselves until about that time in fetal or infant development, correct?
Yes, so studies that have been performed looking at any link between those have found no link between autism and MMR or any other vaccine.
Thank you. And so, as a leader in the state of Texas, you are letting people know the rhetoric around autism and MMR is not accurate. Mm-hmm. This is a safe vaccine. We know about measles. We know that measles can cause high fever and brain damage. We know that kids can die. I want to talk about mumps. Mumps equally, 20% of boys that get it will get such swollen testicles they'll get infertile. Correct?
I don't know the exact statistic, but absolutely that is a complication of mumps.
So if you don't get your little boy vaccinated for MMR, roughly 20% of them may not carry on the family genetics, right?
Yes.
Let's talk about rubella. Rubella, if a woman gets rubella, 70% of them are going to get arthritis, right? And if a pregnant woman gets rubella, there's significant risk of blindness and death, intellectual disabilities, liver and spleen damage to their child.
Correct. Congenital rubella syndrome, yes.
So that's the real implication of us as a state of Texas not paying attention to the public health necessity that we all do our part to get our kids vaccinated, because it's really our kids that are suffering. It's not much of a choice for that kid, right? And so another disease that has been almost eliminated is polio. We also see vaccine hesitancy that carries out not just from MMR, but can affect polio.
Correct.
And we now have an outbreak of polio in New York.
There have definitely been cases in New York, and they have identified it in the wastewater there. So it appears that more than just one person has it there, yes.
And so the time to talk about the efficacy of vaccination, to calm people's fears, to not use illogical rhetoric, but to let people know this really can become an even bigger public health crisis than what we're talking about today, needs to be taken seriously. And I'm so grateful that you're willing to come in and talk about that.
Absolutely.
Thank you,
anytime.
Doctor.